Assalamu alaikum. We are discussing a case of non-functioning right kidney secondary to proximal ureteric stone. All the area, especially the pedicle, is badly adherent to the pelvis. We are dissecting the vein, and here we will see that a small hole will be formed in the vein, which will lead to quite a lot of bleeding. So we'll try to manage that. The first thing is that one hand must be having a non-traumatic forceps. So we are having a non-traumatic forceps in the left hand. We are lucky, and we can hold that area. We can see the area, visualize it. When the injury is not visualized, it's really difficult to control it. But we can clearly see the hole in the renal vein. The renal vein is short as well. So the next thing is, after doing the suction and irrigation, we are thinking what to do. So the next thing is to place another helping and assistant port, which can make our left hand free for use, and then we are thinking of placing a clip. So we have to see where the border of the upper border of the renal vein is. So we leave it, we try to grab the hole just at the inferior border of the vein, and this gives us a chance that we can see the upper border of the vein. So we can very clearly apply a small 5mm Hem-o-lok clip. This gives us a chance to apply a 10mm Hem-o-lok clip, because we are having a 5mm port in our right hand and a 10mm port in our left hand. So luckily the bleed is controlled, and we are also lucky that the kidney is non-functioning, and that's why the artery is not as active as it could have been. So clipping of the vein does not lead to any significant congestion. So after controlling that, we are trying to dissect with our left hand. We can see the artery as well behind the vein, and so we'll make a window around the vein. The idea here is to make a window around the renal vein, then apply 2 more clips so that it is secure, and then we'll just cut it, divide it between the clips, and then we'll try to find the artery and get hold of that. So we are making a window. Again, here we are applying a lot of traction on the vein, but luckily it is not causing any harm here. Creating the window, we are able to see the superior border of the renal vein. So here we can apply a clip, and we can further dissect the vein and see where it is going. So we see the fibrotic tissue along the border of the vein, and we would like to go around the superior border of the vein below where tear has happened. So we are able to dissect that, and then we can apply this clip. We will apply another clip just to be sure, and then we will divide between the clips. Once we divide it, we'll be able to find and dissect the artery. And to our surprise, we see another structure behind the artery, which is going into the renal parenchyma, and we find this to be another vein. So we clip that as well. Now we really have to hurry up, because if there were 2 veins and we have clipped both of them, this may lead to congestion now. However, the previous vein is already disconnected, so the vein which was injured will not be bleeding anymore. And now you can see that we are able to create a window just above the artery. And now, in order to create another window below the artery, we dissect this tissue. And in the meanwhile, we come to know that the clip that we have applied is another vein. So here we can nicely dissect the artery, and after doing this we will apply our most efficient and reliable instrument, which is a 10 millimeter right angle. This will help us make the window bigger around the artery so that the clips can be applied, and hence we are able to apply the clip. We try not to catch tissue in the clip so that it doesn't slip. Now things have gone better. Yes, we can see the opposite side of the clip, and then we apply clip distally, and then we divide this artery. Once we divide this artery, it opens up the anatomy a little more, and we will be able to see that we have applied a clip, but we have applied a clip to one of the tributaries of the second vein maybe. So we open up the window a little more and we dissect around the suspected vein. So it is successfully dissected. You can see the degree of fibrosis. So a non-functioning kidney, which is secondary to stone disease, is not an easy and is really not a simple. It is a simple nephrectomy, but not that simple. So care must be taken, and patient selection in the beginning of the career must be of utmost importance. Thank you very much.